The National Serological Survey of COVID-19 began today with the aim of measuring the prevalence of COVID-19 infection in the society throughout the Sultanate in order to be able to tackle this pandemic of COVID-19. The survey result will be used as an indicator to lift the restrictions and movements and reopen the services in the country. We met with Dr. Saif bin Salim Al-Abri, Director General of Disease Surveillance and Control at the Ministry of Health, and he had this to say.
The National Survey for COVID-19 has been launched today, the 12th of July 2020. The main aim of the project is to look at the prevalence of the disease in the Sultanate of Oman. We are going to do it over the next 10 weeks over 4 stages. Each stage will last for 5 days and then separated by 2 other weeks before the next stage starts. We aim at collecting 5,000 blood samples from people at each stage, with a total of 20,000 people to be involved in the project over the coming 10 weeks. The results of the project will help us a lot in planning the strategic recovery plan for the Sultanate, and also it will help us in deciding about what type of preventive measures to be lifted out. For example, whether it's in the health sector, whether it's in aviation, or whether it's in health education, whether it's in education. At the same time, we are hoping to know about the incidence of the disease across the different governorates within the sultanates, and then across the different wilayats as well, and also across the different age groups of the community and the different nationalities. So this will help us planning for a better future, especially, for example, in selecting new vaccines and about the new targets for the vaccine.
We also asked Dr. Saif about today's procedure, and he had this to say.
So the procedure is that we have provided all governorates with numbers of people which have been selected randomly, and then each governorate from the health institutions, they call people according to the numbers which they have, and also so they ask them, they cross-check with them that they are the right people, and then they advise them to go to the nearest health center or polyclinic for them to fill in a questionnaire, and also for a blood sample to be collected from them. We anticipate that we can do the reports or the analysis of the data within a week from the time of the collection of the samples, and the people will be informed about their results within 5 days from the time the blood sample has been collected.
The success of the study depends on the efforts of all concerned individuals and institutions. We hope all will cooperate in order to achieve the goal of this survey. Abdallah bin Ahmed Rubaiey, Sultanate of Oman Television, Muscat.